Webinar on DDT related issues under the Stockholm Convention and the AFRA2 in cooperation with the AFRA2 project that UNEP is leading. I have, as we have lost a few minutes, I will not say more. Just welcome everybody. And maybe we do a quick round of the presenters just to let you know who is presenting. So I will be the one presenting DDT related issues under the Stockholm Convention. Then we have Carla Baleklan, who will present the Stockholm reporting very briefly, just to see, yes. And then we will move on to a quick presentation from UNEP. That will be Eloise. And finally, there will be a project presentation from the countries that are a part of the AFRA2 project. So with that, I will move on to our first presentation that will be led by Carla. Thank you very much for all of you for joining, and look forward to speaking with you at the Q&A that will happen after the presentations. You feel free to also use the chat if you have any questions. We can answer them when we have a moment between presentations. Thank you.
Thank you, Lina. I'll show my video quickly and then I'll stop showing it just to say hello to everyone. Welcome. Good morning, good afternoon. I'm not sure if there is anybody in the good evening time zone, so good evening. So thank you very much, Lina, for inviting me. I work also for the Secretariat together with Lina in the Science and Technical Assistance branch of the Secretariat. And one of my responsibilities is Stockholm reporting. And Lina asked me here today to give you a short presentation about this obligation under the convention and how it relates to the DDT work that you are all involved in. Can you see my screen? Can you confirm, Lina, that everything's okay?
Yes.
Okay, good, thank you. So I start normally this kind of presentation with a little bit of motivation for you, trying to be motivational for you, because I think many people understand that reporting is for the Secretariat, and that's not true. So why is reporting actually important? And I try to put this view from your side, which is when you are preparing your report, you are actually collecting data and information about your own country and how it's evolving. And therefore, the first motivation for doing reporting is actually to do it for yourselves first. Then you know what's going on at the national level or the regional level, depending on the reporting we are talking about. Then also the second point here on the screen is saying that reporting data collectively allow all parties to this convention, for example, to assess different aspects of the convention. So under the Stockholm Convention, there are different assessments which are supposed to happen to see how the convention is evolving, or what are the areas which are still difficult for parties to cope with or to implement or comply with. And therefore, all these assessments are relevant to understand where we should put our energy, where we are still in need to catch up, what are the problems that the convention are still showing. And one of the means to have that information is through the reporting data and information that we get from all parties. Here is an example on the screen of the output of reporting data. This is just to show that with reporting information and data, we can really tell stories. This graphic here is taken from the latest effectiveness evaluation report that was done a few years ago, showing on the left-hand side, my left-hand side, perhaps I don't know how you're seeing it. So yeah, in principle, our left-hand side, the initial POPs, And on the right-hand side, the POPs listed between 2009 and 2011. And you can see all the blue bars are showing parties that have implemented measures on those specific POPs. And the red are the no's, and the gray parts of each bar is showing the not available information. So if we take the case of Aldrin, one of the early POPs listed under the convention, we see that 116 parties have implemented some types of measures to control this POP. When you look at DDT in this graphic, at that time, we had 118 parties doing so. And when we look at the second part of the graphic, we see that a lot of parties at that time had not implemented measures to control the POPs listed under the convention. So in one graphic, we understand that certain things went well and that for certain other POPs, in this case, we still have a lot of work to do. So this is all based on national reporting data. In one graphic, we tell a lot of stories. One specific example for the DDT is this one to show the historical trend in the use of DDT in the sub-Saharan Africa, so dark blue, or the regions light blue, and the total, which is the dark line at the top. And we can see the nuances and also the difference as we progress over the years. So in the early times, 2000, when the data is being shown here, we had some regions using a lot of DDT and the sub-Saharan African region using less, while that number for the sub-Saharan Africa, for example, grew over time until 2009, and after that it had a decline. And we can see also how it behaved for other regions and for the world in general. So this again is one graphic that shows a lot of possible interpretations here for the work that you are doing. Specifically on national reporting under the Stockholm Convention, the mandate comes from Article 15, and it has different components in it. The idea is, number one, to get information from all parties on the measures that parties are using to implement the different provisions of the convention. Then number two is quantitative data. So we're supposed then to collect information on production, import, and export of each of the chemicals listed in the 3 annexes. No, production, no, but we have information about the Annex C as well, which is not about production, import, or export, but about the unintentional production. And we have the decision that that kind of reporting should take place every 4 years. That was done at the first conference of the parties in of the Stockholm Convention. So the next reporting cycle, for your information only, I'm not sure if you are directly involved or not with this reporting specifically, but the next one is the 5th, and its deadline for submission is next year, 31st of August. Now, one slide trying to make the link with your meeting today. So what is different and what is common between the national reporting under Article 15 and the DDT questionnaire? Let's look at what is different first. So what is different? The scope. The scope of national reporting under Article 15 is much broader than the DDT questionnaire because it covers all articles of the convention, all chemicals listed in all the annexes, and it has different types and different levels of details depending on the area of the questionnaire. And we have, for example, information on measures, strategies to eliminate POPs, stockpiles, available NIPs, some information about the NIPs, some information about technical assistance given or received, information on contaminated sites, plus production, import, export, and some other quantitative information. While under scope, the DDT questionnaire is very rich in details about this chemical, and it goes into much more details about the use, production, formulation, alternatives, very focused on DDT. The frequency of the two are also different. So for national reporting under Stockholm, Article 15 is every 4 years, while the DDT questionnaire is required to be filled in every 3 years. Also, a difference is who are supposed to report under both. For the Stockholm reporting is for all parties to the convention, so 194 if I'm not mistaken. And for the DDT questionnaire, only parties that use DDT, which has been been declining. What is common on the other side is that both questionnaires are asking for some level of information on production, export, and import, while specifically for DDT, in the DDT questionnaire, you have a lot more details about the production. What is also common is normally the responsible authority for compiling information. In both cases, we expect from the Secretariat to receive information from the official contact point, who probably should be working in collaboration with multiple ministries. In the case of the Stockholm reporting, is several ministries. Perhaps for the DDT, it's a more limited number of ministries that the focal point has to liaise with. Our suggestion from Lina and I, we were discussing is that, parties will do the work on the DDT questionnaire. What can they do with this information regarding then the national reporting next year? So our suggestion is that you would collect information once and use it in both reporting options, but making the necessary adjustments as you may see. The questions are a bit different and the level of details are definitely different, but once you do your homework for the DDT questionnaire, you can reuse it for the Stockholm reporting next year. I'll be here in the meeting with you today, but if you have any questions later on, you can approach Lina directly or me. Here's my email. And thank you very much. Thank you, Lina.
Thank you, Carla. Thank you for this very good presentation, just briefly showing the differences and similarities, and also just pointing to the fact that under the Stockholm Convention, there are two different means of reporting on DDT, and they are equally important to be reported on, even if there might in the end have the same information collected at a certain level, but they are. Okay, then we will move forward and I will try to see if I can share my screen. Yes. Okay, Dan, I need your help. Please share my... no, I have it. I see it. Sorry, I have it. Even but I can't click on it. Yeah, like that. Okay, sorry. So I will start by doing a overview of DDT related work under the Stockholm Convention, and then I will go into a bit of detail of the 2021 questionnaire. And my name is Lina Fortelius. Again, if I forgot to tell it before, I'm very happy to be with you here today. So the evaluation of the continued need for DDT is part of Annex B in the Stockholm Convention, and it requires the Conference of the Parties to evaluate the continued need for DDT for disease vector control for at least every 3 years. In fact, this happens every 2 years, as the Conference of the Parties today happens every 2 years. This part is coming from a text when the Stockholm Convention was younger, and Stockholm Convention happened. The Conference of the Parties were gathering every year. Additionally, the COP has endorsed the establishment of a DDT expert group that will provide an assessment of DDT and will make recommendations to the COP on the continued need for DDT and on other relevant issues. DDT. So the Party states, together with WHO, the World Health Organization, and the Secretariat of the Stockholm Convention, selects members for the DDT expert group. There are 10 party nominations, 2 from each region, a UN region, and 5 World Health Organization members, and 3 that the Secretariat of the Stockholm Convention is nominating. The DDT expert group members hold office for a period of 4 years, and this period extends from September 2019 to August 2023. The DDT expert group meets once at least 6 months before each COP and provides a report with recommendations for the COP to do the evaluation on the continued need for DDT for disease vector control. And the DDT review process in the Secretariat has 4 main steps. First, the questionnaire is sent out by the Secretariat, and this happens, as mentioned several times already, every 3 years. The Secretariat undertakes a preliminary assessment on DDT once we have received all the field questionnaires, and the DDT expert group carries out an assessment of DDT after this that will then be presented to COP, that will make the decision on the continued use of DDT for disease vector control. The DDT expert group undertakes a situational analysis of the production and use of DDT. They evaluate the progress in strengthening the capacity of countries to shift from the use of DDT. They also evaluate the availability, sustainability, and implementation of alternative products, methods, and strategies. And they make recommendation on the evaluation and reporting mechanisms sent out in paragraph 4 and 6 in the convention, of part B of Annex part 2, sorry. I was thinking of leaving that out. You can read it from the screen. But anyway. And then finally, they also consider and assess the actions being taken by parties to accomplish the following. And this will be the next slide. So, development of regulatory and other mechanisms to ensure that DDT use is restricted to disease vector control in the country. And also implementation of suitable alternative products, methods, and strategies. And this includes resistance management strategies to ensure the continuing effectiveness of such alternatives. To measure the strengthen measures to strengthen healthcare and to reduce the incidence of the disease being controlled by DDT. And finally, the promotion of research and development of safe alternative chemicals and non-chemical product methods and strategies for parties that are using DDT, with the goal of decreasing the human and economic burden of disease. And then I will go into a bit of the outcomes by the last two meetings of the DDT expert group, the 7th and the 8th meeting, as these outcomes are pretty relevant for parties that are reporting on the use and production of DDT. So, outcomes of the 7th DDT expert group in 2018, I will only present a few. There are much more that can be found in the reports that are found in the DDT section under the Stockholm Convention's webpage. But one thing that the DDT expert group concluded in 2018 was that the response rate of the DDT questionnaire was very low only 41% of the parties listed in the DDT register under the Stockholm Convention completed the questionnaire for 2015 and 2017 reporting cycle. And here I will just mention that there might have been some parties might have mixed the national reporting with the questionnaire and felt that they had reported even if they didn't. So I think that was why I also invited Carla to quickly present the similarities and differences of national reporting. And then the expert group also raised some concerns about poor data quality and especially a specific example of this was that the data on export and import did not match in the questionnaires. So for example, country A was reporting that they exported 3 tons of DDT to country B, but country B did not report that they would have imported 3 tons of DDT from country A. And this created a bit difficulties to do the correct analysis and present to the COP. And there were also indications of DDT use in countries others than those listed in the DDT register under the Stockholm Convention. Then when responding to the questionnaire, there should be special attention paid to the quality of reported data on production, use, storage, export, and import. These are really the main things, and you will see later, I will show you in the questionnaire, this is mainly, the whole questionnaire is about only this. Then they were also mentioning that support will be need to continue the centralizing and disposal of obsolete DDT stockpiles, prioritizing those countries where stockpiles pose immediate risk to human health and the environment. And just to show you on the Stockholm Convention webpage, we have the DDT register. Here are all the 18 countries that are in the register for the moment. And then there is also showing a list of the 3 countries that have already withdrawn from the register. And more information of this can be found under the DDT section on our webpage. I just quickly wanted to mention this, that there is this page that you can go to if you want to know if your country is in the register, if it has been withdrawn, or if you would like to do that, start the process of withdrawal, for example. Then countries that use DDT should establish a system for monitoring exposure among spray workers and recipient households. This was a recommendation from the expert group as well. And parties should monitor for insecticide resistance in vector population using standard WHO procedures. I have listed a few more outcomes, but I think I will move forward to the outcomes of the 8th DDT expert group meeting that was held in 2020. Here there are a couple of interesting outcomes that might be leading to new procedures for parties, but this has to be seen because this has not yet been this is recommendations to the COP that has not yet been discussed or finalized by the COP itself. This will happen only summer 2022 when the second part of COP will be held. But the recommendation, nevertheless, from the DDT expert group's 8th meeting, they reaffirmed the continued need for DDT for indoor residual spraying in specific settings for malaria vector control. But they also highlighted that the global vector control landscape and conditions for decision-making on the use of DDT have recently changed. And there are 3 factors supporting a focused phasing out of DDT. The global use of DDT for disease vector control continues to decline. For example, in 2010, there was only 10 countries, there were 10 countries using DDT for IRS, and in 2019, only 5. And this includes a substantial decline in the DDT amount used in India as the largest user of DDT. All countries that use DDT have a target date for malaria elimination by 2030. And it is assumed that DDT may not be needed after that date. And then third, new insecticide products have become available to protect the communities against malaria infection that could be used instead. Then there are 2 factors supporting the continued need for DDT in short term. And there is an anticipated resurgence in malaria cases and deaths as a side effect of the COVID-19 pandemic. And this may cause countries to revert to DDT for emergency purposes. But so far, a surge in deaths has not been recorded or reported. And in certain countries, DDT may play a cost-effective role in preemptive resistance management strategies for malaria control to provide an additional option for rotations among multiple modes of action. So where and this is especially where cross resistance between DDT and pyrethroid is absent. But the DDT expert group said that, or made the recommendation that taking these contemporary factors into consideration, they would propose a few steps towards a focused phasing out of DDT to the COP. And they propose that parties that are currently in the DDT register should review their needs regarding the use of DDT in order to issue a notification by end of 2022, either for re-registration or for withdrawal from the register. And the COP could then discontinue making the acceptable purpose of use of DDT available for those parties that are not in the DDT register by 1st January 2023. And then the COP would initiate an intersessional process on continuation on a possible phase-out plan with those parties that are in the DDT register and report on the prospect of a phase-out for those parties at the next COP meeting in 2023. And this is not yet recommendations from the COP. I just have to state that again. These are recommendations from the expert group to the COP, and the COP will take these recommendations into consideration when they make their when they do their decisions in summer 2022. But this, I wanted to show you this because these are a bit newer outcomes than the DDT expert group has done before, and there is more push on trying to phase out DDT in a more I'm sorry, I'm losing my words. Anyway, I will continue to the next slide. So the expert group also noted that there are substantial project efforts ongoing in selected countries to dispose of large quantities of obsolete DDT and associated waste. But it's likely that more obsolete stocks of DDT exist in other countries, which also need identifying as safe disposal. And they would like the COP to request all parties to provide information through the national reports under Article 15 about their inventories of the obsolete DDT stocks and on the amounts of methods of their disposal so that the Secretariat would have a better overview. And then the group also agreed, the DDT expert group also agreed that donor agencies should allocate substantial financing to the inventory and the centralizing shipment and disposal of remaining stocks of the obsolete DDT that are still quite a large amount in the world. And for the parties to develop and update and implement national plans for insecticide resistant management. That is basically the things that I wanted to emphasize from the report of the DDT expert group in 2020. DDT under the Stockholm Convention is also part of other reporting tools. One is the effectiveness evaluation. The Stockholm Convention reporting we have already talked about. Then there is the Stockholm Convention financial mechanism and the needs assessment questionnaire. Okay, so now I will go into a more overview of the 2021 questionnaire. The questionnaire was sent out to parties in May 2021, and it's available on the Secretariat website in the 6 official UN languages in Word and PDF format. It encompasses the three-year period of 2018 and 2020, and the deadline of submission is 30 November this year. And parties that produce or use DDT are obliged to report the conditions of such use to the Secretariat using this questionnaire. So now I will just quickly go through the questions, and you should all, or maybe most of you should already have seen this questionnaire that was sent out to all official Stockholm national contact points. And this questionnaire is not changing. It's the same every 3 years. It's directly used from the model that was decided by the COP. And I just wanted to briefly show you there are some questions that are marked with an exclamation mark, and these have a bit more information for you. So first, there is the information of who is reporting, sending the information to the Secretariat. This is very important. It should be the official contact point of the Stockholm Convention, but it should be after the official contact point of the Stockholm Convention has been in contact with especially the Ministry of Environment and the Ministry of Health, or any ministry in your country that is dealing with DDT. The section A of the questionnaire is about the production of and use of DDT, and the in-country production and formulation of DDT. So here there is a table where countries should fill in the production facility and location and net output per year, and this is in kilograms. They're very important that countries report in with using the sorry, I lost my word of it, but using kilograms and not, or tons, instead of some other measures as it becomes very difficult to, and it's very important to specify if you use another measure so that it can be recounted into kilograms to show a good, to give the Secretariat a good comparison. Then is the DDT repackaged or reformulated in your country? This is another question. And if the DDT is exported from any of the production reformulation facilities that you may have in your country. Then it comes to the imports of DDT, where each country should report if they are importing DDT and from which country. Then we come to some stock information in the questionnaire, and here you have a table to provide information on the usable stocks of DDT in your country. And if the DDT is used in the country for disease vector control or for other measures, and the total amount in kilograms again. Furthermore, there is a table for each disease for which DDT is used. And then we come to regulation and control, where the questionnaire is asking if there are national laws or regulations governing or restricting the purchase or use of DDT. And if yes, are the laws and regulations fully enforced? And then they come again, is quality control on the product done in your country? Then we come to resistance monitoring. And here we have questions regarding the surveillance mechanism of monitoring DDT resistance. And if yes, what bioassay test producers are used for detecting DDT resistance. And there is a table you can fill in regarding this. Then we come to DDT alternatives. And here the questionnaire is asking for disease management strategies. Is an integrated vector management strategy endorsed at the national level, or is an IVM strategy implemented throughout the country? And is there research into the development or testing of locally appropriate alternative interventions to DDT? And here there is a table to complete of all DDT alternatives used in your country. And here there is another table where we are asking if the alternatives to DDT have been used in the country but are no longer in use. Finally, there is a section on general human and environmental safety issues, where the DDT questionnaire is asking, is there a program to raise awareness among communities and households on safety issues relating to DDT use in the disease vector control, and which agencies are responsible for assessing these risks? And there is a system strengthening in disease vector control, where there are a few questions regarding to this. I went quickly through the whole questionnaire just for sort of repeating or giving you a fresh vision of what is asked in the questionnaire for those parties that have will need to report on this questionnaire this year and might not. And I wanted to show you the whole questionnaire. So if you might, while I was going through the questionnaire, if you have any questions, please feel free to ask them in the Q&A session later today. You can also send me an email and or a chat while we are continuing with other presentations. Thank you very much. And I give over to Eloise Tooney to present the Afro2 project.
Thank you, Lina. Thank you for the presentation, and also to Carla earlier for the previous one. I'm just going to open the screen. Oop. Can you see the screen?
Yes, we can. Maybe you could also put it in the
Presentation.
full. Yeah.
Okay. Thank you, Lina. And thank you to the Secretariat for inviting us to come to the webinar today. I'm going to hand over the floor in a moment to Emmanuel Chanda, who is the Afro2 project coordinator from the WHO regional office in Africa. And for Dan's information, also then we're going to hand it over to a speaker from Zimbabwe and followed by another speaker from the WHO regional office. So hope that they will be able to come in when their slides appear. So the Afro2 project is a GEF, Global Environment Facility funded project that was started in 2016-2017 and has been going there for 4 years now.
Eloise, sorry.
Yes.
Would you mind speaking closer to the mic? It's difficult to understand you.
Okay.
Thank you.
Thanks, Carla. Is that better?
Better. Thank you.
Great. So the Afro2 project is a regional project in many of the countries that are on the DDT register and still using DDT for malaria control. So as such, the project directly responds to the Stockholm Convention obligations of the parties, and we are supporting the countries to meet many of their obligations that were described in the earlier presentations, including reporting to the convention, testing of alternatives, mapping of waste and stockpiles, and other relevant activities. So we're very happy to be here and to have the participants from our project, the country representatives. The first speaker is Emmanuel Chanda, who is the project manager, who will describe the project overall. So maybe I hand over to you, Emmanuel, and just let me know when to move the slides. Thanks.
Thank you so very much, Eloise, for the elaborate overview of the presentation. I mean of the project in terms of what it is. Yeah, so I'll straight delve into the project overview, and this will start with what the project really is, the goal as well as the objective. Yeah, so the project actually revolves around demonstration of effectiveness of diversified environmentally sound as well as sustainable interventions. Of course, with a view of strengthening national capacity for implementation of innovative vector control interventions in the context of IVM. And you can just click on the Eloise, if you could just help to click so that I can have the rest of the stuff reflected on the screen. Just go on. Again, click. Again. Thank you. Yeah. So in terms of the title, I've already mentioned, and then the goal is basically to get as much environmental benefit as possible, and this is as envisioned in the DDT roadmap. Ultimately, trying to reduce the need and use of DDT. In terms of objectives, basically it's to ensure that national capacities are strengthened and they diversified, as well as environmentally sound and innovative interventions are implemented. But all this is specifically done in the realm of malaria. The project spans 13 countries. Initially, it was envisioned to cover 15 countries, but Tanzania and Ethiopia dropped off. So we have two categories of countries. The first category is composes of countries that are apparently using DDT or have just been using DDT until the recent past, or they're also intending to start using DDT. And these are the countries that are eligible for direct funding for implementation of different aspects of the project, like we'll see later. And then the second category is composed of countries that are not using DDT, but they'll be benefiting from the activities of the project, particularly trainings, meetings, as well as information sharing, as it relates to the outcomes of the demonstrations. Next slide, please. So the project has got three components. There is component 1, component 2, and component 3. Component 1 is premised on the need to promote evidence-based multi-sectoral policy making for IVM and to strengthen intersectoral alliance to facilitate promotion and implementation of environmentally sound and effective innovative interventions. And the expected outcome of this component is that countries develop and implement cross-sectional policies, strategies, and plans that have managerial capacity to fully implement the Stockholm Convention on the use of DDT. And expected outputs are threefold. One, which is quite pertinent to this webinar, is capacity and systems to notify the Stockholm Convention DDT register, with close collaboration between the two entities, the health sector and environmental sector. And then also, like we have heard from Lina's presentation, the development of IVM strategies, but these should be aligned with the global vector control response, which is the current approach to vector control, and ultimately to improve capacity or build capacity and provide requisite equipment for entomological monitoring to inform IVM plans and policies. Next. Component 2 actually is the core of the demonstrations that are happening in the countries, and it involves support to countries to implement IVM approaches. And then the expected outcome is to have 3 effective alternative approaches demonstrated in all the 12 sites in the 6 countries that are implementing the demonstrations. And these 3 approaches, evaluation of house screening and larviciding as community-based interventions. Secondly, comparing winter or dry season larviciding, supported by GSI surveillance and community involvement with the current core malaria vector control interventions, and in this regard, indoor residual spraying. And finally, also to generate and use evidence-based IEC to improve behavioral change. Component 2 is being spearheaded by ICIPE, the International Center for Insect Physiology and Ecology, who the institution that has been subcontracted by WHO to foresee that the demonstrations are well implemented. And there are two outputs, basically production of maps on the distribution and resistance databases, as well as ensuring that the 6 countries implement the 3 effective IFVM approaches. Next, please, if you could just click. And component 3 relates to dissemination of information and sharing of experiences to the broader stakeholders, both at national, sub-regional, and also the regional levels, to influence decisions. And the expected outcome in this regard is countries and regional institutions start using guidelines on IVM and social impact assessments to guide the influence and influence policies on DDT. And so far, we are progressing well, like we will see. The outputs 4, and 2 of them that are pertinent to this webinar, output number 3.3, where we envision 12 national assessments of social impact of DDT on vulnerable groups conducted, and also generation of data on the usage and amount, as well as location of obsolete DDT in project countries. Next, please. So the last slide is basically on DDT reporting, and most of this has already been highlighted by the previous presenters. But just to mention, to say, in the 2015-2017 reporting cycle, from the project perspective, we had countries that reported. Mozambique and Zimbabwe did successfully report, but the other countries, though they made an effort, they were victims of the disparities that were just alluded to by Lina as she was presenting. I think there was a mix in terms of which report to be submitted. And then overall, we do monitor the outcomes, and with eventual reports that are shared. But the take home from the DDT-related activities of the Afro2 project is that there are still gaps in terms of information flow that need to be addressed, and as such, it's good that the objective of this webinar is to circumvent those challenges. And I end my presentation on that point. Thank you very much for your undivided attention. Over to you, Chair.
Thank you. Thank you, Emmanuel. I'm chairing this presentation, if that's okay.
That's perfectly fine. Eloise, go ahead.
So I think there is going to be a single question and answer session where we really do look forward to receiving your questions. And please do, if you have questions, put them in the chat so we can organize ourselves to answer them in advance. Thank you again, Emmanuel, and for all the very good work that has been going on this project. We've recently had the midterm review, which confirmed very good progress, and we'll be very happy to provide further information on any of, to specific questions about the project. Now I would like to move to the next section on our presentation, which is the country experience.
Eloise, we need you to get closer to the mic.
Sorry.
Some of us can't hear you.
Mic. Is this better?
Yes, it's better. Thank you.
Thank you. So let me then introduce the next speakers, and this is really coming to the DDT reporting and the experiences of our project countries. The project was alive and well at the time of the last DDT questionnaire in 2018. So many of these lessons and experiences have come from that time, and we would like to put them forward and have a discussion during the Q&A session on, some of the challenges that were experienced and how we can avoid them, and so that all the countries can report by this November for the 2021 DDT questionnaire deadline. So please may I invite the speaker from the Zimbabwe Environmental Management Agency, Alpha. Please, over to you. Thank you very much for offering to present, and we look forward to hearing from you about the DDT reporting and project management. Thank you.
Okay, thank you so much, Madam Convener. Thank you for giving us this opportunity to meet with colleagues and also share our experiences as Zimbabwe. Just by way of introduction, my name is Alpha Chikurira. I'm with the Environmental Management Agency, which is an institution or an entity of parastatal, which is under the Ministry of Environment, Climate, Tourism and Hospitality Industry. So normally we forward through our party ministry some of these reports regarding the use of DDT.
Alpha, I think you muted yourself. We can't hear you.
So by way of just giving a brief rundown or history of the use of DDT in Zimbabwe, it was initially registered in 1946 for agriculture use in what was called then Rhodesia. And in 1967, it was restricted to the use of vector control, particularly tsetse flies. And in 1972, it was then then restricted to the use of controlling mosquitoes as part of our malaria control program. It was disused and replaced by pyrethroids in 1991 for tsetse fly and mosquito control, but it was then reintroduced in 2004 for the control of malaria again after there was an increase in malaria cases. Since then, it has been restricted to indoor residual spraying for malaria control, and under the Zimbabwe to acquire approximately 140 tons of DDT for malaria control annually. Could you move on to the next slide, please? So under the indoor residual spraying program, DDT is being used in 22 districts. And we conducted a snapshot survey, which indicated that rather 17 of the 58 sites where DDT is being stored actually contaminated the DDT, and there's actually a need for more extensive inventory on how it is being used, particularly for malaria residual spraying. So you find that our arrangement in Zimbabwe is that the licensing authority in terms of chemicals is the Environmental Management Agency. We regulate the basic background is that at the moment we're only using malaria for indoor residual spraying as a means of controlling malaria. Could you go to the next slide, please? So the slide there is just giving us a rundown of the amount of DDT. The slide there is simply showing us the quantities of DDT that has been used in the country for malaria control over the years. And you notice that around 2004, we're using 140 tons, the same amount for 2005, 2006. And there was a substantial decrease in 2006, 2007. And again, as a quite substantial reduction in the year of DDT. And our last reporting session for 2016, 2017 actually showed that we're using about 321.9 tons of DDT for malaria control. So in terms of the institutional framework for DDT, like I indicated earlier before, we've got the Environmental Management Agency, which is a parastate under the Ministry of Environment, Climate, Tourism and Hospitality Industry. And the role of that agency is to license the entire value chain of chemical. The packaging and final disposal. So in terms of the legal environment that we have, is actually responsible for the enforcement of those regulations. So DDT reporting actually falls in the complete arsenal of systems that are in place for the reporting of chemicals. So one of the key strengths that was noted in our system is that the system was developed for the management of chemicals within Zimbabwe, but we were able to then report on which chemicals where they're being imported. Sorry, the system keeps muting my mic for some reason, I'm not too sure. So the Environmental Management Agency has a system in place for the monitoring of chemical imports, all the chemical imports, including restricted chemicals. So before chemicals actually is imported into the country, an approval has to be gained from the Environmental Management Agency. For DDT, the Ministry of Health and Childcare notifies us of its intention to import DDT. We then give an approval, and we then monitor the entire value chain from its importation, where it's going to be stored, how it's going to be transported, who's going to be using it, and the returns are actually then submitted to the Environmental Management Agency. In terms of emergency response, we also then move into to contain spills should the unfortunate happen. There's a spill during transportation, as well as the actual management of any hazardous waste that by then after the BRS program is implemented. So the Ministry of Health and Childcare is also heavily involved in terms of reporting the usage of DDT through inventory management. Initially, before they import any DDT, they conduct an assessment of the number of rooms that they need to then spray in terms of the vector control program. And this is then translated to the amount of DDT that is to be imported in the country. So we only import that which we intend to use in that particular season. Of course, with perhaps a contingency amount being also then introduced to cater for contingencies. The Ministry of Health also assists with the records management and reporting to the agency. We find that the records are actually maintained at each stage, as indicated before, when you're importing the DDT, when it's being transported, when it's for use, and of course, when it's then being given to the operatives on the ground for the indoor residual spraying, they also then fill out records as to how much of that DDT they've actually then used, and this is also reported to the agency. The Ministry of Health also assists with the training of staff, particularly on the management of it's a very hazardous pesticide. So the Ministry of Health then trains its staff on how that DDT is handled, and these returns are also shared with the agency. Again, they assist with the sound waste disposal of any residual material that may be contaminated, as well as monitoring, vector resistance. As of 2019, I can recall that during one meeting, it was actually reported that they've got about 19 entomologists who then assist in ensuring the effectiveness of that particular of the program. Rather, the next slide, please. So the current status of DDT in Zimbabwe, DDT is banned in line with the Stockholm Convention, and this has actually been translated and domesticated in our legislation. The Management Act and Statutory Instrument 268 of 2018. That's the Environmental Management Hazardous Substances Regulations. They've actually incorporated that. And you find that this was actually incorporated in earlier versions of that regulation, which was Statutory Instrument 12 of 2007. So any importation of DDT to the country is to be imported under an exemption granted by, of course, the Ministry of Environment, Climate and Tourism, Sport Industry, through the Environmental Management Agency. So at the moment, we are only allowing DDT to be imported under the Ministry of Health and Child Care, IRS, malaria control program. And this is the compliance with the SI, such instrument that I've discussed earlier on. Next slide, please. So what are the key enablers for effective reporting? From our experience, we find that having a well-developed legal environment to support reporting throughout the value chain is quite important. You know, you don't want to have a situation where DDT ends up in the country, they start running around, or DDT is being used. So a very well-developed legal system which details the responsibilities of the importer, of the transporter, the consignee, and the consigner is very important. So we find that this is actually assists us. We've got a presence at all 6 of the major border posts or border crossings in Zimbabwe. So we're able to screen any chemicals when they come in, and the records generated rather at those ports of entry are then, you know, compared and triangulated with the data from other sources, including the Ministry of Health, including, you know, the users of the DDT program to see whether they're to see the checks and balances in the system. Secondly, the key enabler is having a strong institutional environment and systems in place. And we've been actually quite privileged to have received support under the African Cables project rather, which links, you know, departments of environment or ministries of environment rather, and the ministries of health, and actually then assists in the sharing of information and scientific data to ensure that there's sound chemicals management. We've also been part of the international health regulations, particularly under the core capacity on chemical events management, where we have actually tried to come up, you know, breaking down the silo approach under, you know, to say that for there to be, you know, a healthy environment for people to be healthy, you know, all stakeholders need to then, you know, take up the responsibilities in terms of making that possible. And the other key responsibility is that, key enabler rather, is that there should be linkages in information sharing amongst actors. You find that the information sharing apparatus in the country does not wait for us to be reporting after every 3-year cycle or after every, but rather we've got quarterly returns that have to be submitted by the users of the DDT, quarterly returns that have to be submitted, you know, from our ports of entry, our chemical surveillance program, to say how much of a particular substance has been reported. So for us, I think that having that strong legal environment supported by strong institutional environment systems and information sharing has been something that has been, you know, quite helpful in us being able to then report on our DDT usage tirelessly. I think, Madam Chair, that is my submission. My apologies for the network interruption.
Thank you very much, Alpha. Thank you for the presentation and for the insight into how Zimbabwe is managing it and the wider control of DDT, as well as just the Stockholm Convention reporting. So the next few slides are going to be the summary of some lessons learned and, you know, reflections by our Ministry of Health and Ministry of Environment colleagues from the remaining 5 project countries, where we have worked, you know, intensively. The Afro2 project is a multi-sectoral project bringing together the national malaria control programs with the ministries of environment. And so I'm very happy that we've been able to really have a good consultation over the last 2 or 3 years, and especially since the last reporting deadline for the DDT questionnaire about the kind of traps and opportunities for making an effective reporting. So now I would like to hand over the floor to Mr. Patrick Chabeda, representing the WHO Regional Office and supporting Emmanuel in the delivery of the project. And Patrick is going to speak to the country lessons and challenges experienced in the Stockholm Convention reporting. Over to you, Patrick. Is he connected still?
I think I'm off the headphones. I'm using the, yeah, thank you very much, Alois, and appreciate the opportunity to participate in this webinar. I'm happy to see strong participation from the project countries represented here. We have a wider audience from other countries, and we appreciate the malaria programs and environment senior personnel who have joined us from the project countries. Also, thanks to Zimbabwe for the presentation. As has been highlighted over the last 2 years, we've been working strongly to address a number of the issues that were raised by the first two speakers, Carla and Lena, and specifically under component 3, as highlighted by Dr. Chanda, we're working on delivering on the DDT reporting aspect, which addresses not just the questionnaire, but also inventories, as well as institutional arrangements. And then the social impact assessment part. It's important I just mention this as we talk about everything as the partners here understand it from that context. The social impact assessment, again, it's also something, as you've noticed, came out of the expert group recommendations, is work we'll be doing within these countries to try and establish, and if so, demonstrate that the externalized costs of DDT use are not really considered when its relative cost versus alternatives are considered in its present use. So as far as the lessons learned, it's and you can go on to the next slide, please, Louise. What I'm going to cover in this presentation is the challenges that we've picked up over the last couple of years, especially as the project pace was on course in the pre-pandemic period. Obviously, a lot of the work slowed down in the last year, but during the consultations that were held with each of the 6 project countries, a number of challenges were picked up from each, as well as lessons that could be learned in really trying to have an effective systems in place for institutional collaboration and routine reporting to the Secretariat. So obviously, I'll start with institutional collaboration. This is generally seen as having opportunities for strengthening. And here, obviously, we're talking about between the public institutions responsible for health and under which most of the malaria programs fall, and also the ministries or specialized agencies dealing with environment and reporting to the Stockholm Convention Secretariat. A lot has been discussed about this space, but there still is room for improvement in having stronger collaboration. The issue of the lag time between reporting, this 3-year period is what is referenced by the lag time. Sometimes that creates a challenge in consistency in reporting, as well as changes in personnel as staff are moved around and new individuals have to pick up responsibilities that might slip through the cracks. Number 3 is the issue of obsolete and expired stocks versus active and presently deployed IRS stocks for DDT. And this is addressing the issue, as you noticed in the questionnaire, in the format that was presented. It is possible, and it has been experienced, that there is lack of clarity at the national level at times with if the questionnaire is addressing purely stocks that have been imported for present use, or if the documentation of obsolete stocks is also something that is carried out under these. As you've seen, the questionnaire is not in the business of tracking used and expired stocks. That's supposed to be part of the larger national reporting under the convention. So these are issues that do come up, and clarification from time to time is necessary. I'll move on a bit faster just to keep time in check. The issue of managing national imports. The issue here, we're looking at the flow of DDT when it comes into the countries, and its chain of custody management to ensure that what was imported is actually used in the field in the indoor residual spraying activity, and what remains unused, or and the management process of that has been reported as a challenge. Number 5 talks about gaps in submissions. I think that was talked about. You will hear of conflicting information on whether questionnaires were submitted or were not. So there's an opportunity there to try and address that. And this webinar is part of that process on addressing that gap. Next slide, please. So we have national malaria programs at times have concerns with the tedious chain of custody processes in the DDT procurement. I mean, you're talking about a bulky nature of this chemical and various operational constraints in getting it from stores to the fields. And so that's a real challenge. There's the issue of records integrity or availability. Yeah, this talks to the submission of questionnaires to the Secretariat. It kind of overlaps. I've kind of indicated on the slides where some of the problems were identified. Some of them cut across countries and some are specific to countries. So this kind of speaks to the previous note with regard to individuals who have the responsibility of submitting reports. Sometimes there's conflict of information where some say the reports were submitted and the Secretariat seems not to have received these reports. It seems like a little pesky issue that should be easily resolved, but because it kind of comes out and has these larger impacts, as you saw from the first presentation, towards critical decision making that is taken by the Secretariat based on this information, it's something that needs to be looked at. The question of wastes, again, is something that's important as we talk about DDT here. Many of the sites where DDT is stored, this is usually out in the field where the malaria situation is likely to be at a level that the malaria programs have chosen to rotate DDT in those areas. You might find other issues of wastes, because wastes are not just an obsolete stock of the DDT. in the packages as expired or as residue from what the IRS campaigns have used. You'll also deal with contaminated debris or sludges, and these are issues that the countries need to be properly aware of as they undertake their inventorying obligations under the convention. We also have situations where we don't, it's not really a straight line look at decline in use of DDT. Zambia, for example, as a country, was not using DDT for several years until a year and a half ago when it was reintroduced. So when you have this situation, you'd probably have compliance challenges in getting key personnel up to speed with regard to the compliance requirements. There's also the question of certainty on the existence of the wastes in the countries. Next slide, please. We can jointly address. We're on, excuse me. Yes, so I've kind of addressed a lot of the challenges, and we're weaving in lessons that have been learned within the specific Afro2 project countries in trying to address these difficulties that they face in the work that they do in reporting. There's one important aspect that the convention tries to address is the use of multisectoral, we call them MEAs. A number of the multilateral environment agreements have domesticated their obligations and have multisectoral committees that help improve coordination. So as opposed to creating multisectoral arrangements that are new and focused on just one chemical, which would not be efficient in the deployment of resources, some of the countries with strong support from institutional heads have used existing multilateral environment agreements to convene committees that can drive improved coordination. The Stockholm Convention itself, through its national implementation plan process, also calls for intersectoral collaboration. And these are important because even through projects such as this Afro2, we've experienced situations where actually even making simple phone calls across ministries has bureaucratic hurdles in terms of just getting project activities moving. So that really can create a lot of inertia when it comes to, I mean, situations if there is no project and there's still need for that collaboration to deliver on your obligations. So we're asking countries, even beyond the project, to take advantage of the existence of these mandates to develop and operationalize intersectoral coordination mechanisms so that these platforms can be used to drive the delivery of these obligations. We're looking at, there's also situations where obsolete pesticide disposal initiatives can be coordinated with the waste management needs of malaria programs. This is something that came up where you'll have, for instance, a Ministry of Agriculture or some other sector that is independently and without this kind of sharing of information, working on an initiative on inventorying and centralization of obsolete stocks that could benefit from shared information, where malaria programs could piggyback on those initiatives to be able to reduce costs and address these obligations. One other lesson learned we have is many of the malaria programs have shown that, yes, having procedures and practices to keep track of inventories of DDT and change of custody actually promotes good working relationships across ministries. Next slide, please. And this is typically evidenced through the use of promotion of routine field visits, where environment personnel, whether established national focal points or other key individuals who assist in that work, can actually improve the understanding of the needs that the programs have through site interviews and inspections of storage, space, security practices. And this actually fosters a good working relationship and improves delivery on reporting obligations. We've seen the use of paper systems, personal spreadsheets to track flows of DDT. I mean, this is, I mean, depending on how well this is coordinated, it's also an opportunity that can be used to mainstream into memoranda of understanding across the health and environment sector, where these individualized processes can be made official, such that these processes lead to timely delivery of reporting obligations. Strategic environment assessments. Now, these are processes, I think many would understand that in this forum, coming from the different backgrounds. Most environmental agencies are familiar with global, or at least at a national or regional level, assessments when you're about to introduce new threats, potential threats to the environment. We've seen in Zambia the use of this process, which is very helpful as a capacity building tool, because it brings together the various coalition of interested parties and stakeholders, and that helps again develop a good understanding of what expectations are.
Patrick, this is
Yes.
Lina. We are running a bit short in this webinar now for the Q&A, so could you please wrap up?
Thank you. Just two more slides, one or so minutes. We've seen here the National Malaria Elimination Center develop a DDT supply chain risk management plan as they reintroduce DDT in Zambia. And this can help develop robust systems to manage this new information. On the next final slide. Yeah, we've also witnessed commitments being made to strengthen DDT reporting and stock management. And as actually alluded to earlier, the routine engagements with malaria program personnel and visits to sites is also good in helping corroborate data, so that we're able to properly account for what comes in and what goes out. I think that's my final slide. Thank you very much for your attention to this a bit long presentation, and appreciate the time to present. Thank you.
Thank you very much. I take over from Eloise here, and thank you so much, Eloise, Alpha, and Patrick for this very interesting presentations about the Afro the Afro projects and national experience and lessons learned. they are really, I am sure that our participants here have had a lot of use of them. Okay, so now we move on to the last session of this webinar, which is Q&A. I cannot see any questions that have come in through the chat, but the floor is now open. So please raise your hand and we will give you the floor in the order your hands come in. And we will try to respond to the questions that you might have. If we don't manage to go through all the questions in this webinar, you can also send us emails or messages in the chat that we can respond to later to you or the full group, depending on the question. Okay, so the floor is open. I see. I don't see the full name, but Masainga has a hand raised. Please go ahead.
Thank you very much, Lina. And I just want to thank the organizers of this webinar. I find it extremely helpful in many ways. I think one of the ways is it will help us as countries to build capacity, not only reporting for DDT, but even for the Africa project. So I see it as a capacity building, and I would encourage that. I think for the future, such webinars should be held. One of the elements which I've particularly loved and really appreciated is how you've used one country which has experience in one area and shared, but also even the putting together of various lessons from various countries that I find extremely helpful. So all in all, it's just to say thank you so much for this webinar. Extremely helpful.
Thank you so much.
Thank you.
I don't see any other questions or raised hands for the moment. Eloise, would you still want to say a couple of words, or are you fine?
Lina, thank you. Maybe I do have a question, and I think it was one that came up in Patrick's presentation. Well, in fact, two questions. So one is for the Secretariat. If you can just remind everyone the submission process for the questionnaire. I guess the official contact point, what do they do with it and how do they submit it, practically? And then a second question, which is maybe for the rest of the participants, is on the issue of the data, the kind of reporting and data management. I think we heard that the malaria control programs have got quite well-established stock management system, so presumably they have a data reporting system for DDT import and use. And I guess the question is whether it's if there is an institutional level of sharing that with the official contact point, or if, as Patrick mentioned, it comes down to personal spreadsheets and personal emails. And if that is the case, how could there be an institution, if there are good models of, an institutional arrangement by which that data is officially accessed by the official contact point for the Stockholm Convention?
Thank you, Eloise. I will start by answering your question to the Secretariat about how the DDT questionnaire is submitted. So the DDT questionnaire is submitted through the official contact point of the Stockholm Convention. And but we are really hoping that the official contact point of the Stockholm Convention will share this questionnaire with relevant agencies and ministries that hold information relevant to DDT to get as much information as possible and the most updated information and that the country has. And I know that as your second question is tanging on that, this, of course, it depends on the institutional level of how information is shared. But I would just the procedure for submitting the questionnaire is that once it's finalized, it has to be signed by the official contact point of the Stockholm Convention or higher, and it needs to be submitted by the OCP to the Secretariat. It's enough to submit a scanned document to my email address. Actually, it's to my email address where it should be submitted. Some countries may also wish to send a physical copy, but if you do so, it would also be nice to get the scanned copy if possible. Both options are possible. My contact details are on the questionnaire itself, and they have to be submitted by 30 November this year. And if there is any questions or any technical problems, please do not hesitate in reaching out to me so we can work together to see how this could be done. Thank you. And then for the other question, I think Eloise was referring to any country that is part of this webinar, to see if you may wish to let us know your situation. I see two raised hands. We can start with Clifford Mutero. The floor is yours.
Thank you. I am Clifford Mutero from ICIPE, and I am involved in the coordination of most of component 2 of the Afro2 project, the part that deals with the demo of alternatives to DDT, evaluating the effectiveness of alternative interventions. I just want to share my appreciation of this webinar, and to thank the organizers, and also particularly Dr. Chanda and Eloise for roping us in for this very useful discussion, because it enables ICIPE as a technical partner focusing mainly on the alternative interventions to be able to contextualize the work that we undertake in the whole project, or in relation to all the components, component 1 and 3, where DDT reporting is mainly addressed. And since we undertake a lot of capacity building on issues, vector control at ICIPE, also deal with issues of intersectoral collaboration and formation of interagency mechanisms for IBM, I think we have a much better sense of how going forward, and before Afro2 project comes to an end, we will synergize with the other project partners, and also with Patrick Chabenda, who is advising on the reporting. Incidentally, we have already touched base with Chabenda and had some initial discussions So mine is to simply thank the organizers and say this has been a very informative and timely webinar. Thank you.
Thank you very much, Clifford. I would then like to give the floor to Vilma Soroses from Namibia, please.
Hi, good morning, colleagues. Thank you. It's morning time in Namibia. Thank you very much for the presentations. It was really enlightening and very much informative for us here in Namibia. I coordinate the Afro-2 project in Namibia. So for me, I'm kind of a newcomer to this. And what I wanted to really just request or maybe ask is if it is possible for us, for the countries, to be guided through setting up these multi-sectoral platforms that we are talking about, especially if there are maybe some examples of what is expected, because we are kind of having a bit of a challenge because there has been a change in the focal points and so on in country, and we seem to struggle a little bit with that. If there is some sort of support that can be provided in order to maybe set this a multi-sectoral platform up and to keep it going. That's just my thank you.
Thank you, Wilma, for this question. For the moment, there is there is no specific to DDT platform for multi-sectoral multi-sectoral support, but we can there are some projects going on in the Secretariat where there could be. We also have the Carla, can you help me with the word? I am thinking about our platform where we can share information with parties.
You mean the EIS or the clearinghouse mechanism?
The clearinghouse mechanism. Thank you. So we have the clearinghouse mechanism where countries can share information within the Secretariat, but it's not a platform to help countries with the multi-sectoral work where you can work together. However, I think little by little this is something that is many parties are requesting, and I think there have been discussions in the last COPs to have these requests are always coming up, and the Secretariat is always listening to parties and following the decisions that are made by the COPs. I would now want to give the floor to Gamini.
Thanks, Lina. Let me just say who I am. I'm Gamini from Chemicals and Health Branch, UNEP. And good to see one of the old projects that I have been involved with, going on. Congratulations, Lina, for doing wonderful work. And of course, to the team in Afro-2 project, you are doing wonderfully well. I'm so happy to see the progress. I have two, I don't know, I won't say comments or questions. I was very interested listening to the lessons learned in countries. There are some very interesting points there. The thing that came to my mind was how can we sort of just going beyond making a presentation in a webinar to sort of share this experience with broader global community who may be able to sort of be benefited from these kind of lessons, so that they don't have to either repeat some failures or improve what they have been doing in the past. So that is one thing. So the bottom line is, can we? I think probably this is to Eloise and your your colleagues also. Is there a way? Is there a thinking that these lessons learned are going to be sort of properly sort of documented and brought up to be available at a global level, or at least shared broadly? That is one thing. The second one is about something that Lina, you just tried to sort of responded, and it was kind of very timely that I was thinking about this as well. So this multi-sectoral collaboration, just to at least let the group to know that the chemicals and health branch, we have been also sort of involved in some of these DDT related activities. One of the things that we started with at least 2 countries in the GEF project, this GEF Afro2 project countries, that is Namibia and Uganda, to develop a roadmap towards developing alternatives in respective countries, national roadmaps. So this indeed is multi-sectoral collaboration, how much the different sectors collaborate very concretely, what's their inputs and how they involve and when they involve and where they involve. So it's a kind of a national plan. And nice to hear, Clifford, about the assurance that you provided that that's the sustainability of this your wonderful work is going to be ensured beyond the completion of the project. So we are at least trying with 2 countries, and we have been trying at least quite a long time, but unfortunately we had to stop the work because of the COVID situation, almost 1 year or even more now. But I think it's somehow we need to start at least slow. So that will be 2 countries. So just to let the others to know that we will be working on that. And then this is something that I think, as Lina said, that we need to have like much broader level and intersectoral collaboration mechanisms. And one of the things that I heard from one of the speakers is that you shouldn't have something specifically for DDT. You have to use the existing sort of networks that are already there and see how they can be utilized for this purpose. This is just mainly a comment for information, and the other one was about my question about what about this what are we going to do with these lessons learned. Thank you, Lina, for your patience. Over.
Thank you so much, Gamini, for your question and also for your comments. First of all the presentations that have been shared today will be shared on our webpage. Our Dan have already shared the link to the webpage here in the chat, but I can send a message to all participants after the meeting to make sure that everyone knows where to get this information. And this is probably not going as far as you were trying to think ahead, Gamini, but just to say at least there is one place where this will be shared. And also I just wanted to mention that the Stockholm Convention has also published a document called the Guidance to Promote Effective Stakeholder Engagement for Introduction of Safer and Sustainable Solutions Towards Reducing Reliance on POPs pesticides. This is a document that could be used for stakeholder collaboration and to give some advice to parties. I think I don't see any further questions or raised hands, so I would like to wrap up. I think thank you so much to all presenters presenters today. It has been extremely interesting and useful. Thank you for all the comments and questions. We will make sure to, please do not hesitate to further reach out to me, to Carla, or to Eloise and Patrick. I guess he's also right. I don't know, to Eloise, I will say, to not make any mistakes. If you have any questions for the Secretariat, if they're directly linked to DDT, it will be to me. For the national reporting, it's mostly Carla that will answer those questions. And for the AFRO2 project, Eloise at the UNEP Chemicals Secretariat is the one to reach out to. Thank you all. Wishing you a nice continuation of the day, which time it might be, and all the best.
Thank you, Bob.
Thank you.
Thank you. Have a nice day.
Nice day.
Thank you. Bye-bye.
Thank you very much.
Thank you. Bye-bye.
Thank you. Goodbye.
Thank you.
Bye-bye.
Thank you very much. Thank you.
Thank you very much.
Thank you. Bye-bye. Merci beaucoup.
Merci.